Hi, everyone. My name is Matthew Palakamanil. I, alongside Dr. Cheema and Dr. Nazarali, along with Dr. Damji, our preceptor, had the opportunity to visit Kenya. Today, we'll be discussing the Stop Glaucoma initiative with a particular discussion on Kenya as a case study. Thank you very much for giving us the opportunity to talk about our experience. First, we'll chat about glaucoma. As we know, glaucoma is an umbrella term of diseases with a characteristic optic neuropathy. It's determined by structural change and functional deficit in regards to the visual field. Glaucoma is often known as a silent blinder. Patients often don't recognize that they're losing vision because it's relatively slow and peripheral. However, the effects can be devastating. On the right, we see a normal visual field that subsequently gets more and more advanced in terms of glaucoma functional damage. And in severe glaucoma, we can see that there's only a small remaining central island. Corresponding to this, we can see a healthy optic nerve can become very glaucomatous in terms of cupping in a patient in a relatively short amount of time. In regards to the treatment options, there's three main categories of treatment, including medication, laser, and surgery. The treatment options are often escalated depending on the severity of the patient's glaucoma. As we know, the only modifiable risk factor for glaucoma is IOP, so all the treatments target IOP lowering. This image here shows the age standardized disability adjusted life year, or DALY, rated from glaucoma by country. As evident in this photo, we can see that the morbidity secondary to glaucoma is quite significant in Africa. And we know that glaucoma is the second leading cause of blindness worldwide. And oftentimes, 50% of patients are blind in one eye presentation. This is very significant within the African subcontinent in that patients often do not have a routine eye exam, and patients may have undiagnosed glaucoma and may have significant visual loss at time of presentation. The Stop Glaucoma initiative focuses on improving a patient's quality of life, and there's four main realms to this. The first is capacity building in regards to creating glaucoma specialists that fill the void that is evident in Africa. Furthermore, it includes awareness of glaucoma as a disease. Thirdly, detection of glaucoma through routine eye exams and picking out glaucomatous nerves and visual field defects. And lastly, management through medical, laser, and surgical options.
In Ethiopia and Kenya, there have been many huge leaps made in awareness of glaucoma. Program graduates have worked with local government to launch mass awareness campaigns during World Glaucoma Week for the last 11 years. In Ethiopia, for example, by means of television, radio networks, newspapers, text messages, brochures, banners, and even posters, they've been able to transmit educational messages to citizens across many regions of Ethiopia. The program awareness campaign sought to educate the public about glaucoma as a disease and to lift some of the negative stigma surrounding it. As a result of these efforts, an increasing number of patients are presenting to be evaluated for glaucoma. Existing patients are more adherent to their medications, and patients are more receptive to surgical treatments. Previous Stop Glaucoma Fellows have participated in recent pilot projects with the aim of detecting glaucoma at an earlier stage. The project used teleglaucoma in Ethiopia to remotely evaluate 1,012 patients who were otherwise unlikely to receive care. The fellows are also involved in organizing and participating in outreach activities in various rural and underserviced areas in their respective countries, where patients can be screened and assessed for glaucoma. Through these various efforts, improvements to disease detection and accessibility of care have improved. For example, the recent fellows have been instrumental in securing donations for new equipment, including OCT fundus diagnostic and SLT laser treatment machines. They've embodied the visions of the fellowship of ongoing mentorship and capacity building through their involvement in resident teaching and advocacy. The most recent graduates of the fellowship program come from Ethiopia and Kenya. In total, the program has now trained 3 glaucoma specialists within Kenya. These graduates are now excelling in their roles as clinicians, academic researchers and professors, glaucoma advocates, and institutional leaders. Individually, each of them has roots in a diverse set of institutions and patient settings. However, they've been successful in creating a cohesive, collaborative, and evolving glaucoma care network in Kenya. With regards to glaucoma management, the graduates are able to adapt their therapeutic plans to the resources available, as well as the ever-changing socio-cultural context of the community they're serving. Through ongoing dedication and commitment to improving glaucoma care in Kenya, the next endeavor of the graduates is to create a regional network of excellence in glaucoma with local fellowship training capabilities. This fellowship program would be spearheaded with the formal support of COEXA.
So really, there are a couple key strengths of the Stop Glaucoma project that we would like to highlight. So in particular, for instance, the program addresses areas of important need, such as glaucoma, as previously noted, which is underdiagnosed and undertreated in the region. The program also offers customizable training geared not only to meet international standards, but also is adaptable to what would be feasible in the practice setting of the graduate. For instance, it may not be feasible to spend extensive time training in techniques such as SLT or MIGS such as iStent if those devices are not available in the region that the graduate will be eventually working. Additionally, the program also focuses on working not just on the trainee, but also on building the institutional environment to support them. So this includes working with support staff and administrators to facilitate processes and acquire the necessary equipment to maximize the benefit from the trainees' new skill sets. As noted from the emphasis on building awareness, it's been important to look at the bigger picture and work on public health initiatives that can link to these specialists. And lastly, the long-term investment in the region and emphasis on mentorship has meant that we've reached a point for the program to be self-sustaining. And so once we have reached this point, the graduates can begin to train glaucoma specialists locally, and external involvement from the University of Alberta can be removed. So really, in summary, we again just wanted to emphasize how the Stop Glaucoma project has clearly made a large impact in sub-Saharan Africa over the past 13 years in each of the 4 domains noted. So we've been able to build capacity by training several glaucoma specialists who've become leaders in their local communities. Their dedication to creating a self-sustaining capacity is evident through the creation of their own glaucoma fellowship. Awareness in the region continues to improve with continued public awareness campaigns such as the World Glaucoma Week, and teleglaucoma and outreach programs have increased detection and management of glaucoma in previously underserved populations. Additionally, glaucoma disease management has improved on an individual scale through internationally recognized training, and significant progress has been made in establishing and enhancing glaucoma centers of excellence in sub-Saharan Africa. We look forward to the future with excitement and optimism as the graduates become leaders and advocates for reducing the burden of glaucoma in sub-Saharan Africa. Thank you on behalf of all of us for your time and attention and having us at